Thank you, Mr. Chairman. I wish I'd had more time to calculate getting into this thing that was brought up by both, primarily by Senator McCain. On the mandated changes in your 50-50 program on the fuel that you would be purchasing, just a minute ago in your, Mr. Secretary, in your statement, you said every time the cost of a barrel of oil goes up $1, it costs the department $30 million in extra fuel costs. In fiscal year 12 alone, in large part due to the political unrest and so forth. Well, now, if you do the math on this thing, it appears to me, Senator McCain mentioned the purchase of 20,000 gallons of the algae fuel that was $424 a gallon. I assume that's all behind us now, and we're not doing any more. That was an experiment, and that's gone. But what we are doing now is talking about the cost of the 50-50 blend. The 50-50 blend, as I understand it, and I'm taking the figures from you guys, would be it would be $15 a gallon. Now, your JP5, as I know from my own purchases, is somewhere between $4 and $5 a gallon. So you're talking about an increase of about $10 for each gallon. Is my math off here?
No, sir, that's exactly correct, and it's, again, a test amount. It's 450,000 gallons of biofuel that we bought to do a demonstration at the rim of the Pacific exercise in July off the coast of Hawaii using surface ships and aircraft off our carrier there. But the whole point of this is to establish a competitive industry, and the Navy will not be buying commercial quantities of biofuels or anything else that is not commercially competitive in price. But it takes a little while to get there, and one of the things the Navy can bring is a market for these fuels.
But the figure that I've heard, I thought it was a quote from you, that eventually you'll need 330 million gallons per year of alternative fuels to meet your goal of 50%. Is that correct?
Yes, sir.
All right, that means that that'd be 50%. So you'd be talking about 660 million gallons. You apply your $10 to that, and this is a huge amount.
I'm not going to apply the $10 to that, because when we get to that level, it will have to be the alternative fuel will have to be competitively priced with the fossil fuel that it's being blended with.
Okay, I want not to get into that right now, but for the record, I want you to send me what you just now said and show the documentation. That's not the way I read it, but that's all right. Will you do that?
Yes, I'll be happy to do that.
All right. On TRICARE, we had the Army in here last week, and I kind of pursued this a little bit. I look at some of the changes that are taking place. I know during the Bush administration they were talking about making incremental changes in copay at that time for 07, 08, 09, 10. We put a hold on it in Congress. Maybe we shouldn't have done that, because I know that the cost of health care have doubled since 2001. The budget that we're talking about right now seeks to save $1.8 billion in 2013 and $12.9 billion over the period of the FIDA. So my thinking here, when you calculate this, it's my understanding that the enrollment fees are going to be increased depending on what rank you are, somewhere between 94% and 345%. And I had sent some stuff in for the record when the Army was in here. The administration officials said that one goal of the increased fees is to force military retirees to reduce their involvement in TRICARE and eventually opt out of the program in favor of alternatives established by the 2010 Patients Protection and Affordable Obamacare. You want to comment about that? Do you think that's somebody's goal here?
Well, I will comment about what we've requested in the budget. As you correctly pointed out, health care costs are going up dramatically. Personnel costs are the fastest growing part of our budget. And something had to be done to get that under control. The item that's been recommended in terms of TRICARE is that for working age retirees from the military, that their premiums for TRICARE do go up because in most cases they have access to other health care. But even if they want to keep on TRICARE, the largest increase, which would be for senior officers, would go up to about $2,400 a year for health care. That represents less than half of what you would pay as a federal employee or as a civilian out in the workforce for health care. So TRICARE would still be significantly less expensive than a competing commercial policy.
Have you done any kind of a study, and you just answer this for the record because it'd be a long answer, as to the number of people who are retiring who might not be able to afford this, because that range that I mentioned I think is still accurate. I wanted to get to one other thing, and that is what's happening right now with over in AFRICOM. I know, Admiral, that the obligations that you have, and I got back recently from the Horn of Africa, and I talked to General Losey, and I'm sorry, Admiral Losey, and several others, and so we're concerned about the activity over there. We know that the increased activity in Somalia and along the East Coast, but we also know that more recently the activity is on the West Coast. And I know that times you've had 64 incidents of piracy that were reported in 9 countries off the Gulf of Guinea. I was there and talking to some of the people that they don't seem to have any resources over there. And I wonder how thin you're getting spread down there. Are you able to do all this stuff that you had not anticipated would happen 2 years ago?
We're able to do what we're asked to do in the Global Force Management Plan. What we need to do in the future to get better is we need to coordinate and synchronize with our partners. And what I mean by that, we had an International Sea Power Symposium last October, got together with the Nigerian Navy, the Guinea Navy, the French Navy, and all those of us that operate in the Gulf of Guinea. And what's happening sometimes, we show up and there's 2 of us there, and then there's nobody there for a period of time. So I'm meeting, in fact, next week with the chief of the French Navy, and that's one of the things we're going to sit down and do, Senator. We need to synchronize what we're bringing forward, for us as we move into the future. When we bring on the Joint High-Speed Vessel and the Littoral Combat Ship, we'll actually have a better opportunity to patrol in that area with a ship that resonates better. Yeah,
well, I direct this at both you and General Amos. I was in Liberia just not long ago and met with the Navy and with the Marines there, and a lot of what they're doing, the increased activity in the western part of Africa, the 1206 and the train and equip programs have been very helpful. Would you comment as to that?
Senator, it's been about a year and a half since I was over there on the in the Liberia side, but we put that detachment in there to train those 2 infantry battalions. The previous contractor had been done, was unsatisfactory with the government. My sense in talking with both the President and the American ambassador there and the Chief of Defense was at that time they've been very happy. All my reports have been very favorable.
And Admiral, do you agree with that?
I do agree. It's a very worthwhile fund.
All right. Thank you, Mr. Chairman.
Thank you, Senator Inhofe. Senator Hagan.